Struggling to put food on the table isn't just an inconvenience. It's an urgent health crisis hiding in plain sight for refugees in Utah. It's easy to believe that once refugees arrive in the U.S., their struggles fade away. But here's where most people miss the point. Finding safety is only the beginning. According to a recent investigation by University of Utah Health, many refugees are facing alarmingly high rates of food insecurity, meaning they often don't know where their next meal will come from. Why is this happening? Refugees navigating life in the United States are confronted with cultural, societal, and language barriers. They're rebuilding their lives, striving towards citizenship, and trying to achieve stability. During this complicated journey, access to basic resources like nutritious food can slip through the cracks. But it's not just about hunger either. Food insecurity fuels mental health challenges such as anxiety and depression and increases reliance on unhealthy processed foods, a recipe for long-term physical and psychological problems. But here's where things really get controversial. The rate of food insecurity among refugees can soar up to 85%, a staggering figure that's 6 times higher than what's seen in the general U.S. population. How is this possible in a nation known for opportunity? To get concrete answers, University of Utah Health researchers interviewed 36 refugees from 8 different countries, including Syria, Afghanistan, and the Democratic Republic of Congo. Echoing past research, a whopping 83% said they'd struggled with food access in the past year. One major cause? Losing SNAP benefits, commonly known as food stamps, when refugees get jobs that pay just enough to disqualify them for assistance. But not enough to comfortably afford food along with rent and utilities. This gray area means working harder can actually make refugees more food insecure, a painful irony that deserves open debate. And this is the part most people overlook. Many refugees aren't even aware that local resources like food pantries exist, nor do they know about community gardening programs like Salt Lake City's New Roots, which empowers families to grow their own produce. Why is this critical information slipping through the cracks? As the study suggests, the answer could be translation and outreach. Refugees themselves recommend that simple steps like translating information about food banks and SNAP applications could make a major difference. Additionally, expanding access to public gardens and supporting programs like New Roots provide healthy, empowering alternatives to food insecurity. The researchers also urge organizations working with refugees to step up efforts, including pushing for more funding to help resettlement agencies address these needs. Community groups and policymakers are called upon to play larger roles. Consider the financial stakes. Food insecurity piles up an estimated $53 billion in healthcare costs per year across the country. Tackling this crisis isn't just a moral obligation, it's an economic one too. Boldly put, does it make sense for people seeking a better life to be forced into hardship by bureaucratic hurdles and gaps in support? Should job seekers be punished for their ambition with less access to food? Or is it time for communities to rethink the safety net? We want to know what you think. Do you agree that food insecurity among refugees should get higher priority in public health and policy discussions? Are current measures enough, or have we missed key opportunities for change? Share your thoughts, share your stories, and let's challenge common viewpoints in the comments below.